axilla. First of all, I would like to make a diagram. In this diagram, you can see this is anterior axillary fold. This is anterior axillary fold, and this is posterior axillary fold. Here is position of the axilla. Actual position of the axilla is this. It is pyramidal in shape. Like this. It is like this. The position of axilla is this. If you draw this diagram separately, you will find its shape is like this, like a pyramid. This is pyramidal in shape. So axilla is pyramidal in shape. It has apex, which is not conical, but is truncated. This is base. This is medial wall, towards the medial side, medial wall. This is lateral wall, this is lateral wall. So it has apex, it has base, medial wall, lateral wall. This is anterior wall, and posterior is posterior wall. So it has 4 walls, apex and base. So first of all, we will discuss about the boundary of the apex. Apex कैसे बन रहा है? How it is formed? Which structure form the apex? This is apex. This is apex, and this apex is formed by this is outer border of first rib. Here is position of clavicle. This is position of clavicle, and here is position of coracoid process of scapula, and this is superior border of the scapula. Here is acromial process of scapula. This is spine of scapula. So this is superior border of the scapula, which take part in formation of the boundary. So apex is bounded medially by outer border of first rib. This is first rib. First rib. This is outer border of the first rib. And anterior boundary is formed by posterior surface of the clavicle. And posterior boundary is formed by superior border of, this is superior border of scapula. Superior border of scapula. This is superior border of scapula. So these three structures form the boundary of apex. This apex lies between cervical region and axilla. It is also known as cervico-axillary canal. Some structure of the cervical region passes through this into axilla. This is the region why it is called as cervico-axillary canal. These structures are axillary artery and brachial plexus. Next part, base. This is base. Here is base. After apex, we will discuss about the anatomy of base. The base is formed by if you cut a parasagittal section, at this level, you will find here is anterior axillary fold, this is anterior axillary fold, here is posterior axillary fold, this is posterior axillary fold, and this is pit of the axilla. This structure forms the floor of the axilla. This floor is formed by skin and fascia. Skin and fascia. This structure forms the floor. If you see the transverse section at this level, अगर यहाँ से एक section काट के देखें, then you will find the boundary of the axilla, that is walls of the axilla. And we have discussed about the apex, base. Now we will discuss about the walls, anterior, posterior, medial and lateral walls. So in this diagram you can see here is position of clavicle. On inferior surface, in the clavicle there is groove for subclavius muscle. Here subclavius muscle is attached. This muscle is subclavius muscle. And another structure in relation to this there is pectoris minor. This is pectoris minor. This is subclavius muscle, pectoris minor. And these two muscles are covered by a fascia known as clavipectoral fascia. This is clavipectoral fascia, which inferiorly extend from the suspensory ligament. So this is clavipectoral fascia, which covers subclavius muscle and pectoris minor muscle. Now, here is another structure which lies anteriorly. This is pectoris major, which attached with the anterior surface of medial part of clavicle. This is pectoris major, and this pectoris major is also covered by the fascia known as pectoral fascia. This fascia become continued with the fascia which form the floor of the axilla, and posteriorly it become continuous with, here is subscapularis muscle, then there is teres major muscle, then there is latissimus dorsi. This is subscapularis, this is teres major, and this is latissimus dorsi. So three muscles lie anteriorly and three muscles lie posteriorly. These three muscles are again covered by fascia. Which become continuous with the fascia of the floor. So this part is axilla. This structure form anterior wall, this structure form posterior wall. Now for medial and lateral walls, and we will draw another kind. If cut a transverse section at level of fourth rib, here is fourth rib. This is fourth rib. And here is position of humerus. This is humerus. Here is bicipital groove, and it has two lips, outer lip, inner lip, lateral lip, medial lip, lateral lip, outer lip, medial lip, inner lip. इन दोनों के बीच में this groove is bicipital groove. In lateral lip, the muscle attached. This is pectoris major muscle. This muscle is pectoris major, which attached to this lateral lip. Here is teres major, which attached to this medial lip. And in the floor of the bicipital groove, the muscle attached is latissimus dorsi. This is latissimus dorsi muscle. And here is position of scapula. This is scapula. So this is latissimus dorsi muscle, and this is latissimus dorsi which attached to the floor, and this is teres major which attached to the lateral border of the lower part of the scapula. And here one muscle attached. This is subscapular fossa, and here is subscapularis muscle. This is subscapularis. Same muscle, this muscle, subscapularis. The subscapularis muscle and latissimus dorsi and teres major. These are three muscles which form the posterior boundary of the axilla. And anterior boundary is formed by, in this diagram you can see, this is pectoris major, and deep to this there is another muscle, pectoris minor. This is pectoris minor. So these two muscles are present in this section, but anterior wall is formed by three muscles: pectoris major, pectoris minor, and subclavius, and clavicular fascia. So this is anterior boundary. This is posterior boundary, a posterior wall. Here is a medial wall. On medial, most part of the medial border of the scapula. Here is attachment of serratus anterior muscle. So upper part of the serratus anterior. This is serratus anterior muscle. The medial boundary is formed by serratus anterior, upper part, and muscles lying between two adjacent ribs, that is intercostal muscles. So इसके बीच में दो adjacent rib के बीच में intercostal muscles. So medial boundary is formed by serratus anterior and intercostal muscle. From 1 to 4 ribs And lateral boundary is formed by, lateral boundary is very narrow and is formed by, here is long head of biceps brachii, here is short head of the biceps brachii and coracobrachialis. This is long head of the biceps brachii, short head of the biceps brachii and coracobrachialis. The two muscles form here and three tendons, three parts. Biceps brachii has two heads, this long head and short head, and this is coracobrachialis. These three structures form lateral boundary. So this is the boundary or wall of the axilla. Anterior wall, posterior wall, medial wall, lateral wall. Now content of the axilla. Here is axillary vein. One important content is axillary vein. Another content is axillary artery. Here is axillary artery. This is axillary artery. And here is posterior cord. Here is lateral cord of the brachial plexus. Here is medial cord of the brachial plexus. So in relation with this axillary artery, this is posterior cord of the brachial plexus. This is lateral cord of the brachial plexus, and this is medial cord of the brachial plexus. So these are important contents of this. And the contents are, there is long thoracic nerve of Bell which gives supply to the sertus anterior. This is nerve to sertus anterior. And the content is height. It is filled with fatty tissue. Fatty tissue. Lymph nodes anteriorly, anterior group of lymph node, posterior group of lymph node, there is lateral group of lymph node, there is central group of lymph node, and there is apical group of lymph node. So these group of lymph nodes are also present in the axilla. So this is all about the boundary and contents of the axilla.